Hello friends, this is Sawan Surgical Aesthetics. I'm Dr. Sawan. This is going to be the beginning of Tuesday Talk with Dr. Sawan, where we actually answer some of the most common questions about plastic surgery procedures and a lot of other questions that people are unaware of when it comes to plastic surgery. So welcome to the first episode. Today we're going to talk about something that is really important when people consider rhinoplasty. And I'm not going to talk about rhinoplasty, which is a nose job. I'm actually going to talk about the chin. And why is the chin important? I'm going to use my little friend here, so don't get scared, but this is a skull, as we can see. There's a clear relationship between the projection of the nose and the projection of the chin. And on profile view, the relationship between both is extremely important. So a lot of people, when they come in considering a rhinoplasty or a nose job, because their nose is too big for their face, we always look at the photo and during the assessment or the examination to look basically at the relationship between the tip of the nose or the projection of the nose currently and where the chin is. Some people have a protruded chin, and the profile actually makes the front of the face sort of round or has a curve, and we discussed with the patient the possibility of a chin implant. So what is a chin implant? So a chin implant is basically a material that we use, an implant. It could be silicone or it could be other material, most commonly silicone, like this one here, and it's basically placed along the chin to gain projection. Sorry, I'm going to try and move my hands. So when you put the implant, they come in different sizes. So this is the placement of the implant. It's a little tricky with my friend moving, but you get a little bit more projection to try and match the projected shape of the nose after surgery with the chin implant or with the chin. Now, some of the implants will add projection. Some of them will change the shape a little bit, and some of them will actually reduce this distance depending on the shape of the implant. This is one type. I have another type here, which is a little softer. So I'm going to get it closer to the camera. So this is one type, and obviously it's placed along the chin. Here, we can use my chin. Maybe I do need a chin implant. And here's another type. Now, it's typically secured with either titanium screws, or sometimes we make a little hole in the bone and we place permanent stitches, but this implant is permanent. Now, some people recently have been using fillers to change the shape of the chin. You know, most people want a little bit more defined chin, and some people have been using filler. Well, obviously the main difference between the two is this is permanent, so you get your change in the shape and the volume of the chin permanently, compared to fillers, which is temporary. Sometimes we actually inject fat during, for example, a facelift in somebody in their 60s or 70s, where they actually have resorption of the bone and they need to get a little bit more chin volume and projection. So we just use fat as a fat transfer or as a fat graft from their own. So again, chin implants are crucial to consider during rhinoplasty to have optimum results. That's because the relationship between the chin projection and the nose projection is crucial for the ultimate harmony of the profile of the face. Obviously, this is only the bone, the soft tissue on top of it. Again, friends, welcome to Sawan Surgical Aesthetics Tuesday Talk with Dr. Sawan. If you have any questions, please email us at info. Our email is info@ssa.care, or you can call us at 405-285-7660, and obviously follow our Instagram page at Sawan Surgical Aesthetics, and see you soon.